I'm Ziyad Al-Aly. I'm a clinical epidemiologist at Washington University in St. Louis. So I got the Commodore 64 as a gift from my parents, back when I was a teenager. And really, it sort of, I feel it changed a lot in my life. It sort of introduced me to the world of programming languages and programming itself. And really, more than that, sort of, solving problems and doing things with data. And in a way, sort of informed a lot my career trajectory, informed how I, think about data and eventually my career choice. So I grew up in Tripoli. It was this small city, much smaller than Beirut, in North Lebanon during the Lebanese Civil War. And I could sort of, look back at those days and see it as a tumultuous time. But it's sort of, I think what the war and sort of growing up in war taught me is always look at the positive side. You can always feel, oh well, like that was a traumatic experience, but the other side of it made me more resilient. It made me more hopeful, more optimistic that there may be light at the end of the tunnel, and maybe in a way that made me who I am today. Like I probably would be a different person had it not been for the for the experiences that I had growing up, and the resilience and sort of the perseverance that I developed through through the years. So I think it was formative experience. Obviously, I don't wish it on anyone. I don't really want it's not like a but it certainly was a formative experience in my life. I grew up in Tripoli, which was north of Beirut, and then I had to move to college to Beirut, and it wasn't really that far away, but to me at that time was like a world away. I had recently lost my dad. I had to leave my mom and my other siblings behind in Tripoli and go to college. And college days were difficult because it was kind of like the end of the civil war in Lebanon, but Lebanon was not very stable at that time. Still, the economy was struggling, a lot of problems. College days were in and by themselves also tumultuous for me, like really challenging. But again, I think sort of a resilient person in me sort of marched through it. Did my best to continue to move through college, go to medical school at the American University of Beirut, and then choose to sort of immigrate to the U.S. and came here to St. Louis, did my residency, and then subsequently my fellowship at Washington University, and then stayed here in town. I'm really grateful that people are appreciating the science that we do, that big journals and top journals and news outlets are actually interested in the work that we do and the science that we do. Now, honestly, also beyond that, really what I find mostly keeps me going is really the feedback from patients. We get a lot of feedback from patients every time we publish a paper. It's like, oh, I see some of my symptoms in what you're describing. I feel validated. I feel seen. And I think that's also very, very, very important to me. No one works harder than Dr. Al-Aly. And I didn't really think that he would say something like this, but he said it. And it, in a way, my initial first reaction was tearing up a little bit because I felt seen in some way. And my other feeling was really gratitude, deep gratitude that I have the opportunity and the honor to work with people like that. People who are also committed to moving the ball forward on long COVID and doing science and really working also very, very, very hard. So enormously grateful for the team that we have and especially Yan for all his work. I think if you're not really have your ear to the ground, not paying attention to patients, you may miss this early on. And I think that's really kind of one of the lessons that I learned in this pandemic. And I hope it's sort of a lot of people get inspired by this story. Listening to the patient is really very, very, very important, especially when you have a new disease or a new entity like SARS-CoV-2. Our understanding now, and it's much clearer than it was 3 years ago, that a lot of people with SARS-CoV-2, when they get it, actually do just fine. But some, when they get SARS-CoV-2 infection, they are left with new onset diabetes, heart disease, gastrointestinal manifestations, neurologic conditions like brain fog. Those conditions are serious conditions that impact people. They impact people's lives. And the number of these people is actually not small. Estimates suggest that more than 65 million people in the world may be impacted with long COVID. And that number is growing. So this is really not a small number. And we think it needs attention not only from caregivers and providers and medical societies, but it also needs attention from government and health systems to be able to address the needs of these patients and subsequently also address their disability needs and support systems that need to be in place to help them cope with these chronic illnesses.